Good day, I'm Dr. Dangleben on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. This is your daily medical education tidbit. I want to talk about first-line blood pressure medications for Black patients. Okay, and before I start, I want to emphasize, diet and exercise and lifestyle modification is very, very important in managing high blood pressure. Okay, so some medications are more effective than others in lowering your blood pressure. But again, it has to be it's more of a holistic approach, including the amount of salt you take in, the type of foods that you eat, especially processed foods in managing your high blood pressure. But there's a whole slew of medications out there, right? I talked about ACE inhibitors, I talked about angiotensin receptor blockers, there's beta blockers, these are terms that you hear out there, calcium channel blockers, there's diuretics, etc. But what works best? I would say for Black patients overall, the thiazide type diuretics, for example, hydrochlorothiazide, has shown that it works better in reducing fluid volume and sodium levels, right? So that is important to know, and it's been studied, okay? This is based on scientific evidence, and you can take the time. I encourage people to take the time. Secondly is the calcium channel blockers. Things like amlodipine, nifedipine, right? The Norvasc that is prescribed to you, right? It helps relax blood vessels, right? And Black patients tend to respond better to that type of medication as a monotherapy, meaning as a single agent. All right, so the less effective, I talked about ACE inhibitors, which is actually prescribed quite a bit. ACE inhibitors alone in Black patients is not as effective as the thiazide and the calcium channel blockers such as Norvasc. But if you have kidney disease, if you're diabetic, right, ACE inhibitors such as lisinopril can help, right? And I talked about the side effects like the cough and the angioedema, right? But it's useful, especially as I stated before, if you have kidney disease or you're diabetic, and it will also be better in a combination therapy with a diuretic. All right, the ARBs are relatively newer, and it's not as great as a monotherapy for Black patients, but again, can be used in combination. So in terms of what we call best practice recommendation for Black patients for your blood pressure control, thiazide diuretic and calcium channel blockers. All right. See, I did not mention beta blocker, and it's not first line at all. All right. If more control is needed, you can add the ACE inhibitors such as the lisinopril. All right. But remember, lifestyle modification, lifestyle intervention, diet, weight loss, sodium reduction. All these things are very crucial in controlling your high blood pressure. This is Dr. Dangleben on behalf of Patient's Choice. Check us out in Chemin, Neuf, Pointe, Michel. Have a great day. Have a great weekend. God bless.